As it stands, more than 62 million Americans are enrolled right now in Medicare. For those who will soon turn 65, there's some big decisions that you have to make on your journey to government health insurance, and we are narrowing it down in this segment sponsored by MediGold. Dan Trombley is here to share more about the vital decisions you are going to make on that journey to Medicare. Good to have you on with us, Dan.
Hey, good morning. Thank you so much for having me on.
All right, today you're giving us 5 things to consider. It's always good to have a list, right, to focus on that. And up first, you say, it's all about the benefits, right?
It's all about what's important to you and the benefits. When people are getting on this road to Medicare, they want to know what benefits are important to them. Is it dental, vision, hearing? Is it over-the-counter? Is it travel benefits? Or that most important one that everybody's talking about now, cash back in your Social Security check? Is that important to you?
Absolutely. And your max out of pocket is something that people are always going to look at.
Always. They always want to know what their maximum exposure is. So that's a great point. Always look at your carrier's maximum out-of-pocket benefit for you.
All right, Dan, next up, something I think everyone also thinks about, and it's also related to that, and that is cost.
So when you're retiring or getting ready to go on the road to Medicare and you're looking at joining a Medicare plan, what is your budget? Medicare Advantage plans are going to have a kind of a one-stop shop, come one, come all for one price. Whether it's a zero premium plan or a plan with a premium, Medicare supplements are going to charge you a premium, sometimes based on your age or your gender. Or do you want to go on original Medicare, which everybody's going to pay anyway, and just get a standalone drug plan? So it's always important to budget for your costs when you're going on to Medicare.
Next up, you have to consider your providers. Right? People have doctors they've gone to for years and they want to keep them.
Exactly. I have a relationship with my doctor, so I know how that feels to have to weigh the pros and cons of changing. So if you're looking at going into a plan, one of the first questions is my doctor or my preferred hospital in the network? And just make sure that you know so you don't have an unpleasant surprise down the road.
And I want to talk about MediGold. You guys are owned by Mount Carmel here, well-respected, well-known hospital system, right?
Correct. Yeah, we're part of Mount Carmel Health System. All of our doctors and all of our hospitals, our members have the luxury of going to with no fear that they're not going to be in the network anytime soon. So that's something to set your mind at ease at.
Perfect. All right. Another thing to think about, will you still be working? And even though we might not want to, some of us will be working, right?
Great point. So if you're going to continue to work, the first thing we always recommend is people check with their HR or their benefits department to make sure that they have their employer plan is what's called credible coverage. If that's the case and they're going to continue to work, and certain circumstances, people can actually defer their Medicare Part B and they can continue to work. And there's no late enrollment penalty when they do that if they're credible or if they have credible coverage. When they decide to retire, by all means, contact Social Security, start your Part B upon your retirement date, and you're not going to have a late enrollment penalty at that part. It's all about education leading up to this road of Medicare.
And lastly, you say consider your travel plans. Why is that?
A lot of people, when they retire, the first thing they want to do is get up and travel, right? They've worked their whole life. They've now been able to save enough that they can just travel when and wherever they want to. So ask yourself the questions, am I going to be out of town for a week, 2 weeks, a month? Most Medicare Advantage plans are going to cover you anywhere in the country for emergency and urgent care services. No problem. But if you're going to be a snowbird and you want to, go to a warmer climate and spend 6, 8, 10 weeks somewhere, make sure you know what those benefits are, that the plan that you choose to enroll in, whether it's a Medicare Advantage or a Medicare supplement. The other thing to consider is if you're going to be doing some kind of foreign travel outside the country, make sure that your plan does have some kind of foreign travel benefits in them. A lot of plans do. The one thing to know is Medicare does not cover emergencies or urgent care services outside the United States.
Okay, so it is all about doing the research, about educating yourself, right?
Correct. Yeah, it's all about education. And the best places to do that, ask your friends, ask your family. The one site that everybody goes to is Medicare.gov. That is the site that all plans have to upload their material to. So that's the source of truth.
Okay, perfect. So you can also go to MediGold.com. You can look at the various plans there as well. Lots of great information. Dan, appreciate your time.
Thank you so much. I appreciate it.